If you're over 60, there's something you might be doing every night without even realizing it that could quietly raise your risk of a stroke. No pain, no warning signs, and no idea anything's wrong. You go to bed feeling perfectly fine, but by morning, something's changed. You might wake up feeling confused, unable to speak clearly, or unable to move one side of your body. A stroke, silent, sudden, life-altering. And what causes it might surprise you. Something as simple as how you sleep. As a brain specialist, I've seen it happen far too often, not because of smoking or poor diet or lack of exercise, but because of common sleep habits that many older adults think are completely safe, but they're not. In this video, I'm going to walk you through 9 dangerous sleeping positions and nighttime routines that could increase your risk of stroke, brain bleeds, or sudden blood pressure spikes especially. During the quiet hours of the night when your brain is most vulnerable. If you or someone you care about is over 60, this video could truly save a life. So, let's start with the first one. Sleeping flat on your back without a pillow might feel comfortable. It might even seem like the best position for your spine. But lying completely flat head level with your heart can actually be risky for older adults. As we age, the blood vessels in our neck and brain become less flexible. Blood doesn't flow quite as smoothly. When your head is flat, your brain has to work against gravity to drain blood properly. This can cause blood to pool or slow down in key areas, especially during the early morning hours when blood pressure naturally rises. That's when small clots can form, and all it takes is one clot to block a narrowed vessel and trigger a stroke. The signs? Slurred speech, facial drooping, sudden weakness or confusion. Sometimes no warning at all. That's why adjusting your sleep position, even just slightly, can make a huge difference in protecting your brain. Now, here's something most people don't realize. When you lie flat on your back, especially as you get older, it can actually slow down blood drainage from your brain. Your brain has its own plumbing system. When you're young, it works just fine. But as we age, our blood vessels stiffen and become less efficient. Lying completely flat makes it harder for blood to leave the brain. Gravity isn't helping anymore. And that slow-moving blood, it can pool, stagnate, and over time, create the perfect conditions for clots to form. Now, combine that with a few things that naturally happen overnight like mild dehydration, lower oxygen levels, and changes in blood pressure, and you've got a dangerous mix brewing quietly while you sleep. This is especially risky if you have conditions like high blood pressure, atrial fibrillation, sleep apnea, or a history of carotid artery disease, even being on blood pressure medication that drops your pressure too low at night can make things worse. The simple fix: elevate your head just a little. Raising your head by about 30 degrees helps gravity do its job. Blood drains more easily from the brain. Pressure inside the skull stays balanced, and oxygen reaches the brain more efficiently. Even using 1 or 2 well-placed pillows can make a huge difference. But don't just grab any pillow. Make sure it supports the natural curve of your neck. You want to avoid tilting your chin down too far, which can actually restrict airflow and make things worse. This isn't just about comfort. It's about blood flow to the most important organ in your body, your brain. Now, let's talk about another common mistake: sleeping on your stomach. For a lot of people, this feels cozy and familiar. Maybe you slept like that for years because it helps your back or makes you feel more secure. But sleeping face down, also known as the prone position, can be one of the most dangerous ways to sleep, especially as we age. When you sleep on your stomach, your head has to turn sharply to one side just so you can breathe. That twist puts pressure on key arteries in your neck, especially the vertebral arteries. which supply blood to the back of your brain. That area controls balance, coordination, and even consciousness. And that's not all. If your head sinks into a soft pillow or mattress, it can press on the carotid arteries, two major blood vessels that feed your brain. Blood flow slows down. Veins that are supposed to carry blood away from the brain can get kinked. Blood starts to collect, thicken, and in some cases, form clots. And here's the most dangerous part. Those clots may sit there for hours. But when your blood pressure naturally rises in the early morning, as it always does, they can break loose and travel straight to the brain. When you lie on your stomach, your head has to turn sharply to one side just to breathe. That neck twist can actually reduce blood flow through your vertebral arteries by over 40%. And that's even worse if your pillow pushes your head back unnaturally. It's like putting a kink in a garden hose, only this time, it's the blood vessels that feed the back of your brain. On top of that, sleeping on your stomach compresses your chest. This limits how deeply your lungs can expand, reducing the oxygen your body and brain receive throughout the night. That drop in oxygen forces your heart to work harder and your brain to function with less, but it doesn't stop there. If your breathing is restricted in this position, your body can retain too much carbon dioxide, which changes how blood flows through the brain. This can create instability in your circulation, something older adults are especially vulnerable to. Here's the problem. As we age, our bodies just don't respond to low oxygen the way they used to. A 30-year-old might wake up gasping and shift positions, but at 70 or 80, that same drop in oxygen might go completely unnoticed, quietly setting the stage for a nighttime stroke. And if you snore, have sleep apnea, or take sedatives or sleep medications, the risk is even higher. In these cases, your muscles relax more, your airway becomes more likely to collapse, and your body becomes slower to respond to danger. The result? A greater chance of having a silent, oxygen-starved stroke in your sleep. So if you or someone you love sleeps on their stomach, it's time to consider a change. Try switching to your side. Use a firm pillow that keeps your head and neck aligned. Or even better, sleep slightly elevated on your left side. That position not only protects your brain, but also helps your heart and circulation work more efficiently through the night. This isn't just about getting more comfortable. It's about survival. Because what feels cozy could be putting dangerous pressure on the very arteries that keep your brain alive. Here's a habit many older adults carry quietly into their later years. It seems harmless, even comforting. You pull the blanket over your head at night. Maybe it's to block out a snoring partner or the sound of a fan. Maybe the room's too bright, or there's just something peaceful about being wrapped in warmth and silence. It's a small act, a little cocoon of comfort. But for seniors, it can be a quietly dangerous routine. When you sleep with a blanket over your head, you're not just blocking out noise or light, you're also blocking airflow, and that changes everything. Throughout the night, oxygen levels under that blanket start to drop. At the same time, carbon dioxide, the gas your body is trying to get rid of, builds up in the space around your nose and mouth. When we're younger, our bodies might handle that dip in oxygen without much trouble. But at 60, 70, 80 years old, the brain becomes more sensitive. Recovery isn't as quick, and those small drops in oxygen can trigger big problems. Here's what you need to know. During deep sleep, especially REM cycles, your brain needs steady oxygen to repair and restore itself. When you're rebreathing stale air under a heavy blanket, oxygen drops. Your heart tries to compensate by beating faster. Blood pressure starts to swing up and down. And these changes put stress on fragile vessels inside your brain. Add in a little dehydration, slower circulation, and arteries that have naturally stiffened with age. And you've got the perfect recipe for a clot to form silently in the night. The scariest part, you might never know it's happening. You go to bed feeling warm and safe, but your brain could be starving for oxygen. And by morning, the damage is done. You might wake up confused, groggy, or not fully yourself, or you might not wake up at all. Studies have shown that even mild drops in oxygen during sleep are linked to a higher risk of stroke and cognitive decline in older adults. And this doesn't just affect people with sleep apnea. It can happen to anyone whose breathing is disrupted by sleep posture, medications, or their environment. So if you're someone who sleeps with the covers over your head, even just in the winter, it's time to rethink that habit. Instead of covering your head, try wearing a comfortable sleep mask to block out light, or use earplugs to reduce noise. Keep your room warm but breathable, and invest in lightweight bedding that keeps you cozy without cutting off airflow. Because this isn't about being uncomfortable. It's about protecting your brain. It's about giving your body the oxygen it needs to repair, to function, and to survive the night. Because strokes don't just happen to other people. They happen to good people, thoughtful people. People who just want a good night's sleep. For many older adults, getting a good night's sleep isn't as simple as it used to be. It's not just about falling asleep anymore. It's about staying asleep without pain, aching joints, stiff backs, heartburn, shortness of breath over time. They all lead to one common solution: the recliner. Maybe you know someone who's given up their bed entirely. Or maybe that someone is you. Night after night, the recliner becomes your bed. You find just the right angle. You grab a soft blanket. Maybe the TV hums quietly in the background. It feels safe, comfortable, familiar. But here's the truth most people don't hear, especially not from their doctors. What feels safe can sometimes be silently dangerous. As a brain specialist, I've seen it too many times. Sleeping upright in a recliner can slowly, quietly increase your risk of stroke overnight. Our bodies were designed to rest flat, with blood and oxygen flowing evenly through the brain and heart. But in a recliner, when you're tilted up at 45 or 60 degrees, gravity starts working against you. Blood starts pooling in the lower parts of your body, your legs, your hips, and at the same time, blood flow to your brain may slow down. For younger people, this usually isn't a major problem. But after 60, the game changes. Your blood gets thicker from mild dehydration. Your vessels narrow with age, and your heart doesn't pump quite as powerfully as it used to. Now combine that with gravity pulling blood downward, and you've got sluggish circulation in your lower body. That's the perfect environment for tiny blood clots to form. Clots that may sit quietly while you sleep, until one breaks loose and travels to your brain. One small clot, one blocked artery, and everything changes before you even open your eyes. But there's more. Sleeping upright also interferes with your body's baroreflex, the natural system your brain uses to regulate blood pressure while you rest. When you're lying flat, your brain and heart work together more efficiently. But when you're upright, especially if you're slumped forward or slightly twisted, that reflex weakens. The result, blood pressure instability that can strain your heart and vessels while you sleep. And for older adults, especially those taking medications, struggling with dehydration, or wearing tight socks for swelling, the risk compounds. You're not just uncomfortable, you're potentially putting your brain in harm's way. So if you're someone who sleeps in a recliner or takes daily naps in that chair, consider this a gentle wake-up call. Sleep is not just about resting, it's about positioning your body to protect your brain. If you truly need to sleep elevated, use a hospital-style adjustable bed or a firm wedge pillow that lifts your upper body without compressing your lower limbs, and always make sure to stretch. your legs, move your feet, and support healthy circulation, especially older adults. It feels familiar, safe, and natural. You lie on your right side, tuck a pillow under your head, maybe cradle another between your knees, and almost without thinking, you slide your arm underneath the pillow. You drift off just like you have for years, maybe even decades. But here's what most people don't realize. As a brain doctor, I can tell you, this is one of the most dangerous sleeping positions for seniors. Not because it causes pain, but because night after night, it may be silently cutting off blood flow to your brain, increasing your risk of stroke at the very time you think you're safest. While you sleep, let's talk about what's really happening. When you sleep on your right side with your arm under your pillow, you're putting direct pressure on some of your body's most critical blood vessels, including the carotid artery in your neck and the subclavian artery in your shoulder. These are vital highways that deliver oxygen-rich blood straight to your brain. But when you compress them for hours, blood flow slows, veins get squeezed, arteries narrow. Blood starts to pool and thicken, especially in older bodies where circulation is already slower and blood vessels are stiffer. A small clot begins to form in the stillness of sleep, and then as you shift positions in the early morning, your blood pressure naturally rises with the sunrise. That clot gets dislodged. It travels upward, and within seconds, your brain is deprived of oxygen. That's a stroke. But that's not all this position affects. When you sleep with your arm pinned under your body, you're also compressing the brachial plexus, a major bundle of nerves that runs through your shoulder and down into your arm. You might wake up with that dead arm feeling. But what's actually happening is your nerves are sending distress signals to your brain, signals that can disrupt your sleep cycle even if you never fully wake up. Over time, this kind of stress on the nerves and poor circulation can cause microvascular damage, the kind of slow, quiet damage that builds up until something breaks. And here's the thing, as we age, our bodies become less resilient. Blood thickens more easily. Recovery from restricted flow takes longer, and nerves, they don't bounce back the way they used to. So if you're someone who sleeps like this, right side, arm under the pillow, it's time to make a change. Not for comfort, for protection, try sleeping on your left side instead, with your head gently elevated and your arms resting in front of you or at your side, not underneath you. Use a contoured pillow to keep your neck in alignment and reduce pressure on your vessels, because sometimes one small adjustment can protect your ability to move, speak, remember, and live independently. It could mean the difference between waking up ready for the day or waking up changed forever. You might not feel the damage being done, but your brain, it remembers, and eventually, your body reacts. Because what you don't know while you sleep can change everything when you wake up. And if you think sleeping on your arm is risky, just wait until we dive into the next topic. What it really means when your body tosses and turns all night long, and why restlessness itself might be your brain's way of sending a warning before a stroke ever happens. Frequent tossing and turning is a warning sign from the brain. There's a kind of restlessness that sneaks in with age. You wake up more often, you shift from side to side. You toss, you turn, and maybe you just chalk it up to getting older. Arthritis, a sensitive bladder, or trouble getting comfortable. But what if I told you that this pattern of constant movement at night might be your brain trying to warn you? And worse, it might actually be triggering the very danger it's trying to avoid. A stroke. As a neurologist, I see sleep not just as rest, but as restoration. During deep sleep, your brain balances pressure, clears toxins, and restores blood flow. But when that process is interrupted again and again, especially in seniors, the consequences can be devastating. Every time you roll over quickly, shift your head, or reposition your neck, you're temporarily altering how blood flows to and from your brain. In a healthy 30-year-old, no big deal. But in a 70 or 80-year-old with stiff arteries and fragile veins, each of those movements can reduce circulation for just long enough to do damage. Add in a little dehydration, maybe some low oxygen levels, or a missed blood pressure dose, and you've got a dangerous mix. Even more concerning, research suggests frequent tossing and turning isn't just a symptom of poor sleep. It might be your brain's way of gasping for balance. So if your nights are restless, don't ignore it. Talk to your doctor. Check your medications. Track your oxygen and hydration, because sometimes the body whispers before it screams. Skipping blood pressure before bed is dangerous too.